My name is Sarah Blach, and I am an epidemiologist and lead our hepatitis C disease team at the CDA Foundation based in Colorado. And the reality is I'm not the expert in Switzerland, but we have all of the experts in Switzerland here. And so over many years, I think almost 10 years now, we've been working together with really some fabulous experts from Switzerland to collect data on hepatitis B and C in Switzerland with the goal of producing disease burden models that may help us to estimate the disease burden today and into the future. So my expertise is actually in modeling, and we've taken the data collected by so many here to help with that. So here are my disclosures just to begin. Now, on the Polaris Observatory website, which is an initiative of the CDA Foundation, we've essentially gathered data from over 110 countries for hepatitis C and over 160 countries for hepatitis B, and essentially pooled all of that information, including the underlying data that was published by the Swiss Federal Office of Public Health. We use that in our models, and then we're able to generate some of the outcomes that you see here. So at a high level for Switzerland, what we see is about a 0.4% prevalence of hepatitis C, and the data for hepatitis B is a bit outdated. I'll talk about that a little bit later, but a starting point of about 0.5% prevalence for hepatitis B. So we're looking at about over 70,000 people in Switzerland who are affected with hepatitis B or hepatitis C. And we see that about 2/3 of them have been diagnosed, but less than a quarter have been initiated on treatment. And so these are data points that we'd like to change, because our goal for CDA Foundation is to help with elimination. And in order to eliminate, we need to make sure that patients are being cared for. For hepatitis B, we also look at birth dose and prophylaxis associated with prevention of hepatitis B. Now, in order to achieve the Swiss hepatitis strategy targets for hepatitis C, which is a reduction of 90% morbidity and mortality, we would need to treat over 3,000 people per year. And what you can see in the figures here are the modeled outcomes associated with two different strategies. One is the status quo in black, and the other would be achieving the Swiss hepatitis strategy in green. And the graphs on the bottom and on the top right essentially look at the outcomes, so total infected cases, liver-related deaths, and hepatocellular carcinoma. And then on the top left graph, what you can see is the number of patients needing to be treated. And if we focus in on the black line, you can see our status quo would be fairly low level of treatment. The green line would be what would be necessary to achieve the elimination targets. And when we're saying about 3,000 patients per year, that seems like a large number, but the reality is Switzerland has treated that many patients before. And there was a decline even before COVID in the number of patients treated. And some of that has to do with the COVID pandemic, and some of that has to do with the fact that it's actually difficult to continue finding patients who need to be treated and cured, or need to be given preventive measures. And so that's where we started to look at subpopulations. Where are the patients who are still needing to be identified for intervention? And so this is a study that we published just last year, led by Dr. Beal. And what we looked at was where the subpopulations still resided, who still has hepatitis C in Switzerland that we maybe haven't addressed yet. And the largest outcome that we saw was about 56% of hepatitis infections were actually among people who were born abroad. And this may not be a huge surprise, as we discussed earlier, or as was discussed earlier. There are a lot of people in Switzerland who were born abroad. There are a lot of migrants coming into the country. But this is definitely a group that's worth focusing on. Now, in addition to people who are born abroad, about 28% of infections are estimated to be among people who were born in Switzerland, who have a history of injection drug use. We also estimate 20 to 30% would be among people who are actively using drugs or who are engaged in opiate-assisted therapies. And then there's quite a few people, about 14%, who don't have a history of injection drug use and were born in Switzerland. And you'll notice these do not sum to 100%. There's a lot of overlap in these groups. But when we're talking about strategies to find patients and to make sure that individuals are engaged in care, this means there's many different ways that we can access them. But one prominent way, of course, is finding migrants and making sure that they're engaged in care as well. So this isn't surprising to most of you, I'm sure, but more than 25% of adults residents in Switzerland were born abroad. Switzerland is an incredibly diverse country, and that is such a phenomenal thing. And of those individuals who are born abroad, about 60% come from 11 different countries. So this is not people who have hepatitis B or C, this is just the general population. And also, as expected, Germany, Italy, Portugal, and France account for most people who are born abroad. But as we'll see a little bit later, these are not necessarily the countries with the highest prevalence of hepatitis B or hepatitis C. So on this graph, we actually include 80% of permanent residents born abroad in their countries of origin. So as I mentioned earlier, the Polaris Observatory maintains disease burden models for quite a few countries. So when we were starting to estimate how many migrants or how many people who are born abroad in Switzerland have hepatitis B and C, we first started with the number of people living in Switzerland with hepatitis or without hepatitis, and then we multiplied by the prevalence of hepatitis B and C based off of the data that we had in our models. And the nice part about this is we're able to look at any given year. Of course, for hepatitis B, because we have vaccination campaigns for 20 to 30 years in many parts of the world, it's important to look at the most recent years of data or the data that corresponds with when people entered the country, because somebody migrating to Switzerland from China today has a very different prevalence of hepatitis B than somebody who might have migrated to Switzerland from China in 30 years ago. So it's important that we have all of this information and are able to apply it in the years that are most relevant. So focusing back on hepatitis C, what we estimate is that just under 18,000 infections with hepatitis C are among people who are born abroad, and this is where that 56% number came from. And of those, about 60% came from 13 different countries. So as you remember on the first graph, Germany accounted for the majority of people born abroad in Switzerland. However, what you can see here is that because the prevalence in Germany for hepatitis C is lower, Germany falls lower on this list for number of people who are infected with hepatitis C. And you see Italy at the top there because Italy historically has had a high prevalence of hepatitis C. Now, there are many other countries on this list as well that are really important to consider, and we'll talk a little bit about some of those later. Now, where are these hepatitis C infections located across the country? As expected, if you're looking at the raw number of cases of hepatitis C among people who are born abroad, we're really looking at cantons with very high population counts, so Zurich and Vaud. If you're looking at it from a prevalence standpoint, we're really seeing that mostly in Ticino, where we have a large number of people originating from Italy. So some of these findings were not particularly surprising, but it's nice at least to be able to have these by canton. Now, this is just kind of looking at the data a different way. So we have country of origin on the left-hand side, and where people are originating from, those hepatitis C infections are originating from, and then which cantons they're ending up in, essentially. And this, again, is just based on those population counts and the prevalence of hepatitis C. And as noticed earlier as well, a large number of people coming from Italy who are essentially ending up in Ticino. But Zurich has a much more broad mix of hepatitis infections from different countries. Now, if we look at this slightly differently as well, so this is the same data set but applied at the canton level. This is the permanent residents born abroad in each canton based on the percent of total infections. So what you can see is that each canton actually has a different mix of infections from people born abroad, and a lot of it is as expected. The German regions of Switzerland have a larger number of hepatitis C infections from German people or people who originated from Germany, and then down in the southern regions, you see more infections from Italy. But it's also important to note, we heard about Ukraine earlier, and we know that there are a large number of recent migrants coming in from Ukraine. The data shown here is really a kind of snapshot in time based off of 2019. And when we're having new people come in, whether it's through refugees or other migrants fleeing wars or other circumstances, they may be distributed a little bit differently. However, what we can see from this is that there may be different cantons where we can apply different screening strategies or different treatment strategies to most effectively reach the migrants who are in those cantons. So you may not want to apply the same campaigns trying to find Italians when you're in Zurich, because most of the Italian population would be in Ticino. And same thing goes with some of these other countries. If we're looking at people from Romania originally, you may be looking more at the northern part of the country when you're trying to develop local language strategies for initiating people on treatment or getting them into care. Now, if we switch to hepatitis B, unfortunately, we don't have the same low-level data at the canton level. However, we do have data in terms of the number of patients who were born abroad who have hepatitis B. And for hepatitis B, we followed the same protocols and the same procedures we did for hepatitis C. So we took the number of people in the country by age, by sex, and then by country of origin. And we applied the age, sex-specific prevalence rates to that population census to estimate the number of people who would have been born abroad. And as I mentioned in one of the earlier slides about the Polaris Observatory data, you'll notice that we had suggested somewhere around 40,000 people in the country with hepatitis B. But when we start to do this kind of a bottoms-up approach, so starting with the number of people born abroad in Switzerland and then applying those prevalence rates, we would actually estimate that there are about 50,000 people who currently live in Switzerland who were born abroad who have hepatitis B. So we're already estimating that the prevalence of hepatitis B is higher in Switzerland than may have been previously published and previously expected. And if we look at the country of birth for many of these people who may have hepatitis B, you see a very different profile than you would for hepatitis C. We're really looking at most infections coming from Turkey, Portugal, Eritrea, Philippines, and some differences as well in the numbers. So it took 14 countries to get to 50% of all hepatitis B infections, whereas for Switzerland, or for hepatitis C, I'm sorry, it was a smaller number of countries accounting for a larger percent of all hepatitis C infections. So some wide variety here, but I think the key message is that in order to really eliminate hepatitis B or C in Switzerland, we have to focus on finding patients and who may be different from the typical Swiss population. We have phenomenal programs in Switzerland for injection drug users, for other high-risk groups, but I think it's important that we really also focus on how to reach migrants in a way that's culturally sensitive, that's really focused on their needs, and finding them in places where they may already be congregating. So to conclude, overall, more work is needed to achieve the Swiss hepatitis strategy targets for viral hepatitis. More than 50% of hepatitis C infections, and we would estimate at least 80% of hepatitis B infections, are estimated to be among Swiss residents who were born abroad. And this is not considering refugees or people who may have entered the country recently. This is really just looking at permanent residents. It's important that we develop culturally sensitive campaigns to diagnose and treat hepatitis B and C, and also to provide vaccination services and other prophylaxis services for hepatitis B. And these might be best tailored to the canton level. There may not be a single approach that works for all of Switzerland, but understanding the mix of residents in each canton may be useful for helping with these strategies. One idea that came up when we were doing our hepatitis C work was engaging immigration centers and pharmacies or other places that may be first point of contact for immigrants. This could help increase case finding and linkage to care, but it's also very important that care is delivered in a timely fashion. I was told from a colleague recently that there's some great programs to diagnose migrants coming in from Ukraine for hepatitis B and C right now in Switzerland. However, there's still fibroscan requirements or other requirements that may prevent them from actually receiving treatment and care. People may be lost along the way. And I will defer to all of you as to what's actually going on in practice right now, but making sure that whatever strategies are developed are also very focused on the fact that patients may not be around for very long, or we need to make sure that those are happening in an efficient and effective way. And with that, I'd like to thank you all for your attention, and also to thank all of our collaborators for their support and help with this work so far. Thank you.